Again, I want to thank everybody for a great day. I want to thank the planning committee for putting together a great selection of speakers. I feel like we really hit the mark today. I can speak on behalf of the committee and planners that I really feel like we did accomplish some things today, really tackled some issues. I know there's so many that we could tackle and spend so much time on this topic, but let me try to summarize. And I'm going to have a disclosure here. I just got back from New Zealand on Sunday night at midnight. Okay? All right. So if I don't make any sense, I'm completely blaming it on that. All right? Okay, guys. So there were a lot of themes that came out of each session, and what thankful to Shaban and Sarah helping VENCE and I to kind of put this together and thinking about what themes came out of different session. And I think one of the main things, like when we hear the community speak, is fear around genetics, distrust we have to be very aware of. Geography is destiny. We've heard that. We've talked about language barriers. We've talked about confusion, lack of guidance through the process, high tests of cost and care. We've talked about insurance coverage issues, and just communication, and what that means. And I think Natasha had said it very nicely, that communication, it's not a transaction, it's relationship, and how we need to really think about our communication and relationship with people over time. And so I think those were all, and obviously we probably did not capture all of this, but I think those are good things for us to focus on. In session 2, we were talking about the role of health systems in delivering equitable access. The key takeaways, advances in treatment and technology lead to increased disparities in healthcare. So we really need to be careful that we aren't, and that came up again, I think Rena brought it up again, was that we cannot be introducing genomics and have it increase the gap that we already see. And I think we have to be really cognizant of that as we move forward. We also talked about challenges in handling DTC results in the clinic and how we deal with that. And also all of the balancing demands in clinic. That came up over multiple times about how much time people really have with their patients or clients or consumers, and how do we do better at that. There were also potential ways forward. We talked about a lot about navigators with cultural expertise. We talked about developing evidence-based guidelines on and trust in communication, stratifying populations, expanding education and resources for clinicians and patients to help overcome logistical challenges. And one of the things that came up over and over again is really targeting our population and their genetic and health literacy, and helping that rather than just focusing on provider and clinician literacy. All right, I'm going to kind of skip around, guys. Section 3, how can providers make genomic medicine more accessible? Test affordability also came to the forefront. I thought the framing the question differently was that Sean brought up was interesting. Are we reducing health disparities through the targeted use of genomic medicine? Shift to alternate payment models and how that's affecting what we do. We also talked about, like, how can we think about maybe some demonstration projects or pilot projects within our own institution. I believe somebody go to your own employer, think about getting involved in decision making on what's covered, and doing something like University of Michigan has done. And how can we kind of tap into that and get more information from some of those kind of microcosms that we can create. Understanding which conditions are the biggest disparities and figure out how genomic medicine could be helpful for those conditions. And then requesting insurance payment, we obviously know is complicated and burdensome. I probably don't have to, but we haven't earned the right for it either, right? That's what I've also heard from Reed. So how can we move forward, focus on care prevention, move genomic testing into quality improvement? So we heard a lot about that, trying to treat genomic medicine in a more similar fashion that we do with other things that we're trying to implement, and facilitate better provider-patient, obviously education, decision, all of that as well. Okay, session 4, exploring innovative solutions and opportunities. So we talked about to achieve an educated public with participation from all sectors requires investment in innovative approaches and a much more diverse public health workforce. We talked about diversity across workforce in general, keeping in mind again that we don't have to have somebody at the same background to be effective, but we do need to think about why we are so homogeneous in our provider population and ways we can address that. We need policies to foster training of counselors and clinicians in effective communication. Added time in clinics for patients may mean less resources for day-to-day living expenses. Tools exist to help identify patients in underserved areas and assure these patients are represented in studies. Other needs where subjects want their genetic data and want providers to have access to it. We had potential ways forward is meeting the community where they're at. We talked a lot about going out to the community rather than the community coming to the academic medical centers. We talked a lot, and we've heard multiple times before about having participants, community participants as co-leads, co-PIs, not just consultants to large research projects. So we've heard multiple recommendations about that. And also the increase in the communication between academic medical centers and safety net providers, and again, increasing the diversity of genetics workforce. Okay. You sure you don't want to take over? Okay. Identifying unmet needs to alleviate healthcare disparities. So again, Reed did a great job, and I'm not going to go through all of these things because I think he did an excellent job at coming up with point after point of what we really need to focus on with a lot of clarity. So this slide hopefully captures quite a bit of that, and also some of the discussion that we had with our panelists as well. And so let me, this is it's going to take time, I think, to kind of think about everything that we learned today and how we synthesize this and really think about maybe some overarching themes from all of the different sessions that we had today. And importantly, again, what can we do to move the needle on this as we move forward? And that's something that our chairs of the roundtable push us on. We push ourselves on, is to really think about, this is nice. We've had like a really good discussion about this, but how do we actually have some action items to take away from this meeting and make movement? We would love to hear from you guys. So we have the survey, right? And Vince, maybe you want to say a little bit more.
So you have a pink survey that is really to help the roundtable about what to do next. What are some areas and topic areas that you think are important for the roundtable? But I also want to challenge each of you to take this email address and to reflect on today and to provide some feedback of what the roundtable can do related to the broad area of healthcare genomics disparities, and to give the roundtable your best advice. So that's my challenge to you, is that you take that, you send feedback to go along with all the things we've captured about today, but to help to inform the roundtable as they think about their next steps. So I just want to thank you. I think it's been a great day. But I want to challenge you to take the email and give us additional information, feedback, recommendations to help the roundtable in their next steps. And I want to just thank the roundtable for inviting me to be a co-chair. And I look forward to seeing what the roundtable does next on this topic.
Thank you so much. We are adjourned, right?